This is Alicia Alt, reporting from the International AIDS Meeting in Washington, D.C. The International Association of Physicians in AIDS Care released a consensus statement on treatment as prevention, or TASP, and pre-exposure prophylaxis, also known as PrEP. I spoke with Dr. Kenneth Mayer, chairman of the association's task force on the issue, about the consensus paper.
Over the past 2 years, there have been some unprecedented developments in HIV prevention. One study that found among heterosexual couples, starting treatment earlier was associated with fewer new transmissions. And then several studies looking at the use of drugs for HIV uninfected individuals who are high risk for HIV. But there are a lot of questions that still remain in terms of implementation, ethical considerations, resources. And so we felt that it would be good to assemble a group of experts to talk for several days and try to hammer out a sense of what we know and what we don't know and the way forward. In June, we had a meeting in London. There were more than 400 participants. It included clinicians, it included researchers, public health officials, as well as community activists and people affected by HIV. And these people were from 52 different countries with a variety of different perspectives.
And what would you say were sort of the nutshell recommendations for both TASP and PrEP?
For treatment as prevention, there was a strong consensus that the data are there. We have definitive data that this works. The questions now are how to implement it. And that means scaling up testing all around the world. It means trying to figure out ways to engage people in care and to get them to consider medication if they feel it's to their benefit, and then once on medication to be adherent to avoid the development of drug resistance, and to work with counseling to decrease transmission to others. For PrEP, there was also a sense that the data are strong that this can work, but we see PrEP as a much more limited intervention because for many people, condoms, being faithful, may be appropriate ways to reduce their risk, but there's some people who will not use condoms who are at very high risk for HIV around the world. Men who have sex with men, female sex workers, and then couples where one partner is HIV infected, the other's not infected. PrEP may offer an added level of protection for the uninfected partner.
So with an increased call for testing and also early treatment, what kind of role do you envision for the primary care physician or the OBGYN?
I think HIV treatment has gotten easier and easier, and I understand that people think this is something very specialized and it's not my problem. But here in the United States, we have more than 200,000 people living with HIV who are unaware that they're infected, and about 50,000 new infections every year. And then of the more than 800,000 people who have a positive HIV diagnosis, some of them do not establish good patterns of care, so they may know that they're HIV infected, but they may only show up in emergency rooms. And it's so important for primary care providers who are really the bulwark in any kind of effort of treatment as prevention to be comfortable enough to at least test people for HIV, and if they don't feel comfortable initiating treatment, then to know who to refer to. But the test is cheap, the test is simple, the test is highly reliable, and we really want to give people the advantages of starting treatment early now.